Hello, I'm Colonel Doug Merritt, the Command Inspector General for the U.S. Army Southern European Task Force Africa, or Setaf-Af, and I'm here with Major Amity Felice. We're going to talk to you about the Army Substance Abuse Program, or ASAP, and Substance Abuse Disorder Clinical Care, or SUDC. This video will address both substance abuse and suicide prevention. Substance abuse is a challenge that defense forces face every day. The use of alcohol, drugs, and other substances results in soldier misconduct and reduces their effectiveness to conduct missions. In many cases, the behaviors related to substance abuse negatively impact the trust within our forces and with the citizens we are sworn to protect. Additionally, substance abuse impacts soldiers and unit readiness by reducing their capabilities physically, emotionally, and mentally. Suicide is another global issue that affects security forces. The stress involved from being away from families, conducting combat operations, and other stressors routinely push our personnel to their limits. This is an issue that the U.S. Army spends a lot of time and resources trying to prevent. To better understand the U.S. Army's approach to substance abuse and suicide prevention, I'm going to turn it over to the experts.
The mission of the Army Substance Abuse Program is to strengthen the overall fitness and effectiveness of the Army's workforce, to conserve manpower, and enhance the combat readiness of soldiers. It is important to understand that this is a commander's program. The Secretary of the Army and Chief of Staff of the Army implement guidance from the Secretary of Defense. The Secretary of the Army is responsible for the ASAP program, along with the Army Sexual Harassment and Assault Response Program, or SHARP, and the Army Suicide Prevention Program. Although the program is executed through the Chief of Staff of the Army, with the G1 being the proponent, the Assistant Secretary of Army Manpower and Reserve Affairs has oversight responsibility. The Director of the Army Staff coordinates between the Assistant Secretary and the Army Chief of Staff. The Army G1's Resiliency Directorate, or ARD, is responsible for ASAP, SHARP, and suicide prevention. The Army Substance Abuse Program has 8 primary objectives. The overall goal is to increase individual fitness and overall unit readiness. They provide services which are proactive and responsive to the needs of the Army's workforce and emphasize alcohol and other drug abuse deterrence, prevention, education, and rehabilitation. ASAP implements alcohol and other drug risk reduction and prevention strategies that respond to potential problems before they jeopardize readiness, productivity, and careers. ASAP assists with restoring to duty those substance-impaired soldiers who have the potential for continued military service. They provide effective alcohol and other drug abuse prevention and education at all levels of command and encourage commanders to provide alcohol and drug-free leisure activities. The ASAP staff are appropriately trained and experienced to accomplish their missions. They strive to achieve maximum productivity and reduce absenteeism and attrition among civilian corps members by reducing the effects of the abuse of alcohol and other drugs. ASAP improves readiness by extending services to the soldiers, civilian corps members, and family members. The Army Substance Abuse Program team provides drug and alcohol abuse and suicide prevention education for military personnel, families, Department of Defense civilians, host nation professionals, and retirees. Prevention education is broken down into 3 main programming areas: alcohol and drug prevention, risk reduction, and suicide prevention. The Army Substance Abuse team consists of the Army Substance Abuse Program Manager, Drug Testing Coordinator, Prevention Coordinator, Employee Assistance Program Coordinator, Suicide Prevention Program Manager, and the Risk Reduction Program Coordinator. The ASAP Drug Testing Coordinator, or DTC, is a subject matter expert for military drug testing procedures, the turn-in point for urinalysis samples, and conducts civilian, random, and pre-employment drug testing. The DTC also provides Unit Prevention Leaders, or UPLs, initial certification courses and recertification training. The Employee Assistance Program, or EAP, provides short-term problem-solving counseling, coaching and mentoring sessions, referrals, and follow-up services for Army civilian employees, retirees, and adult family members. Additionally, EAP coordinators provide consultations to supervisors and managers and prevention education classes for civilian work centers. EAPs offer help to resolve issues affecting employee effectiveness and productivity at work, such as work-life imbalance, stress, workplace conflict, financial difficulties, substance abuse, and relationship concerns and parenting difficulties. The ASAP Prevention Education Program provides substance abuse awareness training to military units and civilian agencies. Presentations can be held in person or virtually. Prevention coordinators utilize various training aids to allow training to be engaging for participants. The ASAP Risk Reduction Program, RRP, provides a means to help commanders reduce high-risk behaviors in their soldiers. The Risk Reduction Program Coordinator provides tools to assist commanders in ascertaining and mitigating high-risk behaviors. These tools include the Unit Risk Inventory, or URI, and the Commander's Risk Reduction Toolkit. The RRP Coordinator plans and coordinates the installation prevention team meetings. The Suicide Prevention Program Manager, SPPM, serves as a commander's subject matter expert on Army policy, procedure, and training requirements related to suicide prevention. The SPPM can provide training resources and coordinates train-the-trainer courses within the community. The unit commander has a key role in the Army Substance Abuse Program. Unit commanders must observe their soldiers' behavior and intervene early to identify possible alcohol and/or drug misuse, refer these soldiers for evaluation by trained medical personnel, recommend enrollment in treatment programs, and when appropriate, process soldiers for separation.
If a soldier is identified as having a substance use disorder, the soldier's military leadership command refers him or her to the local medical treatment facility, or MTF, Substance Use Disorder Clinical Care, for clinical treatment under the Department of Behavioral Health. Treatment determinations are made by providers to include the determination if the service member meets the criteria for enrollment in mandatory substance use disorder treatment. If enrolled in mandatory treatment, the leadership of the soldier will receive regular updates regarding the progress of the soldier, and the soldier will also have ongoing mandatory testing. If the soldier does not comply with the treatment or is shown to have further alcohol or substance abuse, then a recommendation will be made for the soldier to be administratively separated from the Army. Soldiers are also encouraged to voluntarily seek substance abuse care prior to any involvement from their leadership or prior to testing positive on any substance abuse screening. If the soldier seeks treatment voluntarily, no updates will be provided to the chain of command. In regards to suicide prevention, the primary roles are also divided between prevention efforts and clinical treatment for mental health disorders. The installation command and units, brigades, battalions, and companies are focused on prevention training to bring awareness to the latest suicide prevention techniques and skills that can be used by everyone. These efforts will encourage leaders and peers to identify changes in behavior or mental outlook, such as significantly decreased performance, looking tired or worn out, pulling away and withdrawing from others, and increased alcohol use. If identified, soldiers in distress can be encouraged to seek care through behavioral health. And if the command team finds it to be a significant concern, especially if worried about the safety of the soldier, then they can command refer for a mandatory behavioral health evaluation. Following any evaluation, the mental health professional will make recommendations for ongoing care to the soldier. And if the provider has safety concerns, they will pass along necessary information and recommendations to the soldier's leadership to keep the soldier safe. It is important to note that most information shared by the soldier remains confidential, and only information required to keep the soldier safe, such as no access to firearms or not suitable to live in a remote or austere environment, would be passed on to their leadership. Information gained about their relationships, childhood traumas, or other personal information would not be shared unless required to keep the soldier safe and healthy. The maintaining of confidentiality is vital to ensuring trust in the behavioral health department, thereby increasing early utilization and better maintaining of a ready and resilient force. The vast majority of patients seen in behavioral health are seen on a voluntary basis because they want to improve their lives and become psychologically stronger and more resilient. U.S. Army Behavioral Health uses a model to ensure strong communication between combat Army leaders and behavioral health providers at the military treatment facility. Department of Behavioral Health has embedded behavioral health teams located near any brigade-sized combat arms headquarters, so soldiers can easily access behavioral health services. Each team has a social worker, psychologist, and substance abuse counselor aligned to a battalion. This alignment allows battalion and company leaders to know the behavioral health provider, When necessary, this allows strong communication to see if any significant behavioral health condition will lead to administrative or medical separation from the military, or if the soldier can be treated and return to duty and be an even stronger and more resilient member of the fighting force. The primary role of the Behavioral Health Department is to treat soldiers using psychotherapy and potentially psychiatric medication management for suicidal thoughts and behaviors, depression, anxiety, post-traumatic stress, as well as relationship and occupation-related stress. The goal for all appointments is to return a soldier back to duty. However, if necessary, behavioral health providers will make recommendations to limit or remove soldiers from duty whenever substance abuse, suicidal behavior, or other mental health disorders will significantly impact the welfare and safety of the soldier or their unit. Knowing how to check or respond to personnel considering suicide is extremely sensitive and hard for people. As a training tool to ensure every soldier can detect and know how to respond, the U.S. Army developed the ACE card. It is a playing card that uses the moniker Ask Your Buddy, Care for Your Buddy, and Escort Your Buddy. Every soldier is given this card and trained routinely on how to detect and respond to suicidal ideations. This is just one of several tools our forces use.
The Army spends a lot of time and resources dealing with substance abuse. As a commander's program, they are responsible for testing and handling problems in their formation. In a perfect world, drugs, alcohol, and other substances would not deteriorate readiness. But the world isn't perfect. The ASAP program is a readiness builder for our forces, and it can be for yours as well. We collaborate with many other programs to ensure soldiers, families, and civilians are provided with the most recent and useful information to assist with the prevention of alcohol and drug abuse prevention and education.
The Army Substance Abuse Program, in concert with SUDC, is a comprehensive program which combines deterrence, prevention, and treatment designed to strengthen the overall fitness and effectiveness of the Army and to enhance the combat readiness of its personnel and units by eliminating alcohol and other drug abuse. Actions taken to prevent, deter, and reduce alcohol and drug misuses are the single greatest key to ASAP and SUDC success. Additionally, trying to prevent suicide is everyone's responsibility. The Army takes this very seriously and has a lot of resources that we can make available if you are interested. Substance abuse and suicide have terrible impacts on security forces. It's a matter of taking care of the personnel who spend their lives protecting and caring for the citizens of our countries. ASAP and the Suicide Prevention Program work hard to prevent both issues every day. They train and employ the entire force to be part of the solution. If you are interested in learning more about the U.S. Army Substance Abuse Program or Suicide Prevention Program, please contact the Security Cooperation Officer in the U.S. Embassy in your country and ask for an engagement with the Setaf-Af Inspector General Office. We look forward to working with each of you to protect our soldiers and forces from the negative impact of substance abuse and suicide. Thank you.